Stress affects the whole family and is considered in the nursing care plan. Understanding the signs and symptoms of stress and initiating self-care and self-management is vital for everyone. Stress is psychological, emotional, or physical response, an adaptation to a real or perceived life obstacle. It's a normal aspect of life, and responding to stress is needed psychological process for regulation and homeostasis. It is caused by physical, emotional, environmental, or mental changes. It may be positive or negative depending on one's perception. A stressor is an event, experience, or environmental stimulus. One's perception and responses determine whether a certain stressor is positive, which is also known as eustress, or negative, distress. Positive stress can be associated with accomplishment or achievement. It produces feelings of well-being, inspiration, and motivation. Unhealthy or prolonged stress and poor coping strategies will lead to physical and emotional fatigue and ill health. The hypothalamus secretes corticotropin releasing factor, which activates the sympathetic nervous system to release norepinephrine, epinephrine, and dopamine. The fight or flight response symptoms include an increase in heart rate, blood pressure, and cardiac output, dilation of bronchial airways, pupil dilation, an increase in blood glucose levels. The anterior and posterior pituitary glands release adrenocorticotropic hormone, or ACTH, from the adrenal cortex. ACTH stimulates the adrenal gland's release of cortisol. Cortisol triggers behavioral responses of mental alertness, focus, reduction of pain receptors. Cortisol also has immunosuppressive and anti-inflammatory effects. Once stress is gone, the brain signals the body to recover and reestablish balance by replacing lost nutrients and eliminating waste products that are accumulated. When stress occurs, the body works to maintain homeostasis by initiating the general adaptive syndrome. This is triggered by physical or psychological stressors or events. It has 3 stages. In the alarm stage, the central nervous system is aroused. The body defense mechanisms are mobilized. Hormones from the adrenal cortex place the body in a state of readiness or the fight or flight response. The rising hormone levels cause an increased blood pressure and heart rate, blood glucose levels, oxygen intake, pupil dilation, and mental alertness. If the stressor poses a severe threat or prolonged duration, this will equal a progress to the resistance stage. In the resistance stage, the body resists and seeks to counter stress. The parasympathetic nervous system tries to return the body back to homeostasis. The body remains on alert, hormonal and functions revert to normal, and the body repairs damage that has been caused by threat of stress. In the exhaustion stage, the body cannot defend itself against the stressor. The body's capacity to stand or adapt becomes depleted, and resources are exhausted. Prolonged stress exposure results in disease or illness. Chronic exposure to increased endocrine or neural responses causes wear and tear on the organs. This causes an allostatic load. This can cause long-term physiological problems, such as chronic hypertension, depression, and autoimmune disorders. With the immune response, stress causes the body to produce increased levels of cortisol, which is the stress hormone. Cortisol improves immunity by limiting the inflammation, when it's released in small amounts. A prolonged increase in cortisol level, the inflammation will increase and cause impaired immune function. This will cause a decrease in the lymphocytes or white blood cells. Chronic inflammation causes a development and increase of immune-related disorders, cardiovascular disease, arthritis, psoriasis, inflammatory bowel disease, and some cancers. Transactional theory of stress and coping. Here, the individual appraises a stressor and determines how to respond to the stressor. The appraisal is influenced by personal and contextual factors. These factors are cognitive, physiological, affective, psychological, and neurologic skills, abilities, and resources. In this theory of stress and coping, the individual goes through two stages of appraisal, primary and secondary, before responding to the stress. The primary appraisal, the individual evaluates the situation and determines if a stressor poses a threat. If determined that it's not a threat, then it will be dismissed. In the secondary appraisal, it is determined to be a threat. The individual assesses if they can cope with the situation. They will examine the balance of the situational demands, the risk, uncertainty, and difficulty, with the available resources they have, social support, expertise, and past successes for addressing the threat. The process of reappraisal repeats the primary and secondary appraisals. It is ongoing and continually reassesses the nature of stressor and the resources available for responding. The sources of stress can be either acute or chronic. Physiological stressors are associated with injury or illness, such as exposure to extreme temperatures, trauma, injury, illness, or pain. The body's reaction to acute stressors is immediate and necessary for survival. Chronic stressors can result in debilitating conditions. Physiological stressors are more common and cause emotional unease. A physiological stressor is an event, situation, comment, condition, or interaction that is interpreted as negative or threatening. These commonly include work, academic pressures, financial difficulties, change in marital status, or a victim of a natural disaster. Chronic physiologic stress can be debilitating and incapacitating. Stress is categorized by three types: acute stress, episodic acute stress, and chronic stress. Acute stress is the most common and frequently experienced type, usually brief and either positive or negative. Acute stress causes immediate reaction and biological response to perceived stressors and triggers the fight or flight response. Signs and symptoms include irritability, chest tightness, headache, gastrointestinal disturbance, sweaty palms, and shortness of breath. Episodic acute stress occurs with experiences and frequent bouts of acute stress. This is often associated with taking on more responsibility than one can reasonably handle and frequently feeling disorganized and rushed. Signs and symptoms of episodic acute stress include a short temper, irritable, anxious, tension headaches, hypertension, and migraines. The pattern of episodic acute stress leads to pessimistic outlook and negative worldview. Over time, this can negatively impact relationships, work, and overall health. Chronic stress is a disabling condition that occurs when stress levels are heightened, constant, and prolonged. Individuals believe they have little or no control over the situation or circumstance. Chronic stress produces continuous activation of the nervous system and causes or increases serious health problems. These would be anxiety, depression, cardiovascular disease, cancer, and suicide. This stress is from serious life problems. These would be poverty, racism, illness, disease, or dysfunctional family. Stress-related disorders are due to prolonged and heightened levels of stress and anxiety. The onset and severity of the disorders are affected by the type, frequency, and intensity of the stressor, the person's perception of the stressor, their access to support, and the ability to effectively cope with the stressor. Acute stress disorder is due to an overwhelming event that causes intense and dysfunctional reaction. If the symptoms last beyond a month, post-traumatic stress disorder will be diagnosed. Individuals diagnosed with acute stress disorder have been exposed to frightening or traumatic event, a death of a loved one, a threat of serious injury to self or others, exposure to war or violence. The signs and symptoms of acute stress disorder are an experience of feelings of numbness, disconnectedness, depersonalization, and other dissociative symptoms, disrupted sleep, irritability, difficulty concentrating, becoming easily startled. Many mentally re-experience traumatic events and avoid people, places, and things that are reminders of the event. Post-traumatic stress disorder is due to an experience of prolonged and heightened stress following a traumatic event. This event can be an accident, sexual abuse, or a natural occurring disaster. And this is diagnosed with post-traumatic stress disorder. PTSD is the most common mental health disorder that is associated with the chronic course and debilitating symptoms. The signs and symptoms include recurring and intrusive memories or flashbacks of trauma, nightmares, sweating, increased heart rate, exaggerated startle response to certain noises or experiences that are reminders of the trauma. Irritable bowel syndrome is a common chronic gastrointestinal condition. The signs and symptoms are abdominal discomfort, cramping, bloating, diarrhea, and or constipation. This is not a disease process. It is a functional syndrome with no known cause. This does impact the quality of life and exacts substantial toll on overall health. Stress is a common trigger. Treatment planning includes stress-reducing techniques and activities. A crisis is an emotionally significant life event or major change that pushes an individual beyond the ability to cope effectively. This can include unexpected or unanticipated events with insufficient time to prepare or respond, highly threatening incident or disaster, radical change in life with corresponding lack of ability to respond effectively. The nurse must assess for risk factors and warning signs related to potential acts of violence and apply interventions to decrease and treat the risk. Risk factors would include a history of substance misuse and addiction, history of violence toward animals and people, history of psychiatric illness, a history of depression and suicidal behavior, family history of abuse and neglect, ongoing relationship problems. A crisis creates an imbalance, confusion, and situation where usual coping skills are inadequate. Situational stressors are created by personal, family, or work-related issues. Moral distress occurs when an individual is placed in a difficult situation where actions taken are different from what the individual feels is ethically correct. Physical and psychological signs and symptoms include feelings of frustration, guilt, insomnia, fatigue, and result in withdrawal and depersonalization. Developmental or maturational stressors occur throughout the lifespan as one moves through the stages of life. Adventitious stressors or disaster events, because these are generally rare and unexpected. These include a natural disaster, floods, earthquakes, war, interpersonal disasters, physical or sexual assault, acts of terrorism. Socioeconomic stressors include poverty, homelessness that contributes to mental health, includes self-reported distress and diagnosis of clinical disorders. Cultural stressors include beliefs and values that influence how an individual perceives and responds to stress, since all determine stressors within the context of their culture. Stressors perceived as highly stressful in one culture may be viewed as a minor stressor within another culture, and coping strategies will vary from culture to culture. Coping is the use of strategies that have been adopted to deal with stress and are influenced by psychological, sociological, and cultural factors. Stressors and coping mechanisms vary throughout life and depend on the appraisal of stressor, the amount and type of social support that's available to manage, the importance placed on the stressor, the severity of the stressor, and the ability to cope effectively and healthy. Health promotion is the art and science of helping individuals change their lifestyle to achieve optimal health. A healthy diet and nutrition is one way. This will decrease the impact of stress by strengthening the immune system, lowering blood pressure, supporting overall good health. Consumption of complex carbohydrates will stimulate the production of serotonin. This is a chemical that increases the sense of well-being, decreases stress, stabilizes blood sugar. Vitamin C helps lower stress hormone levels, strengthens immune system. Omega-3 fatty acids provide protection against disorders like heart disease, depression. Black tea helps recovery from stressful events. Healthy fats help lower cholesterol levels, reduce inflammation, and protect against the effects of stress. The mechanical effects of munching on raw vegetables helps to decrease tension by releasing a clenched jaw. Exercise is a good coping mechanism. Cardiovascular exercise increases oxygen circulation and produces feel-good chemicals or endorphins. And this exercise includes Pilates, yoga, Tai Chi. Time management is good for coping. This helps to stay organized and is a stress-reducing strategy. Identify tasks that require immediate attention. Personal resilience. Resilience is the ability to overcome life's challenges and adapt to adversity, trauma, and stress. This is gained by practicing mindfulness activities. Mindfulness is a state of paying attention, being completely present and alert to the surroundings and environment, focusing the attention purposefully on the present moment, being aware of what is happening now, and conscious of the internal and external worlds without judgment. Rest and relaxation. A regular pattern of adequate rest and sleep is necessary. Adequate sleep is needed for the body to repair and restore and to release melatonin. This is the hormone for regulating the sleep-wake cycle. Complementary and alternative therapies are treatments of aromatherapy, herbal medicines, acupuncture, massage, biofeedback, and meditation. Keeping a journal of thoughts, feelings, and emotions. Expressing gratitude reduces anxiety.